Hello, everyone. Welcome to the seminar Talk with the Expert, episode 2. Today we have amazing guests here, Henry McKinner, our two-member and sports pharmacist with post-graduation in drug and sport from International Olympic Committee, and Roy Turnham, representing IBSA in blind sports, Paralympic blind football, and disability sports advocate for Great Britain. Thanks, both of you guys. Today we are going to talk about the prohibited medicines. So let's start. As we usually say, doping is a challenge in sport, affecting not only the integrity of competitions, but also the health of our athletes. The seminar aims to raise awareness about the medications athletes that may take in, and it's potentially a risk of doping violation. Understanding the medications we take, this is essentially special, especially for athletes who must adhere to strict anti-doping regulations. Okay, maybe common medications may contain substances that are prohibited and get some sanctions. Our speakers today are going to provide valuable information regarding how to navigate through this complex issue. And let's begin. Let's introduce first our pharmacist, Henry. Please, thanks for coming. Can you do a short introduction about your background?
Absolutely, yes. Well, nice to meet you all. So, my name's Henry. I'm based in the UK and England, and I'm a sports pharmacist. As a sports pharmacist, my role is to ensure that athletes understand the medicines that they're using. And it's essential to talk with a healthcare professional before you take any medicines, as some may contain banned substances. This can also happen even if the medicines are available to buy over the counter without a prescription. You should always check the World Anti-Doping Agency list and ask your doctor or pharmacist if they have questions or you have questions about your medicine. Prevention is the key to ensuring that you remain within the rules of fair play.
Oh, thank you so much, Henry. I can tell personally that Henry it's an incredible key for us. He's not just help us on the TUI team. TUI team is when you send the papers to request authorization to use the medicine. We have a team of pharmacists, doctors, and they are at home work with us. Henry is one of them, based in the UK, as he said, but we have many around the world, in Egypt and Brazil. So thanks. And also Henry sometimes help us with education activities like we had in the World Games in Birmingham in 2023. He has a huge knowledge not just about the TUIs, but also regarding anti-doping environment. Thanks, Henry. And let's hear about her, Roy. Roy, thanks for being here. Could you just introduce yourself quickly because we don't know who is going to what this in the next weeks. So please share your experience, your insights.
Thanks for having me. So I've represented in England and Great Britain. I was a junior athlete with UK Athletics. That was sort of many years ago now, nearly 30 years ago. When I started with athletics, I became onto the UK development squad for athletics when I was 16, 17. That was where I first became aware of the responsibilities around anti-doping, which we had some very useful workshops. But then I progressed for the last 14 years. I've been a member of the England blind football squad, have gone through sort of drugs testing several times, sometimes in competition, sometimes out of competition. And it's obviously it's something that is very important. And even to this day, you know, as I guess an experienced athlete, I don't think you can ever have too few reminders of the responsibilities, and just to make sure that you keep yourself safe, and make sure that you understand the because these things change as well. You know, some things are legal and then they get made illegal, so you have to keep on top of that even when you've been doing it for a long time.
Yeah, I totally agree. I think that the most important sentence that you said is how we can keep safe because medication it can give to us not sanctions on a sport environment to be like 2 years out of competition, but sometimes we can have a health damage. We are going to have a session just for this, but sometimes we can have a heart problems or even hormone issues that can damage your bones, your muscles. So it's very important to understand that it's the medications, like you told, can be safe or not for us. Medications can sometimes be easy to buy, but it's not the right one. Thanks, Roy. You're totally right. It's amazing to have athletes here that show this to happen to everyone, not just for one single athlete. Henry, uh, you know that you know many athletes. You know the type of requests we receive in our TUI forms, but could you explain to us some steps that the athletes should take to stay informed, understand how they can be aware of taking many medications or how to choose the best medication? Can you explain to us in a very simple way the best way to pick the medication or avoid the wrong medication?
Absolutely. So as Roy mentioned, first and foremost, that the banned medicines change a lot. So even if you knew some information before in the past, it might change in the future. So you should always remember that. But generally speaking, it's very important that athletes understand that common medicines, like the one that Roy took, can contain banned substances. So even if the medicine looks the same as the one that you have in your country, perhaps if you're in a different country, it doesn't mean it's necessarily the same medicine, and it could actually have a banned medicine inside it. So you need to definitely be aware of that if you're abroad. And even in your own country, if you purchase a medicine without a prescription, so maybe you buy from a shop or from a pharmacy, it can have banned medicines inside it. So what I would say is be aware that the guidelines do change, and be aware that there are resources out there to help you. But the most important one is to always check with your doctor or your pharmacist if you have prohibited substances or you need to take medicines that you need to check. But you can also check online using the World Anti-Doping Agency's prohibited list. And that, although that can be confusing, that can be a very useful tool to help you in knowing what is banned and not.
No, yeah. Sorry, Henry. Yeah, it's the athletes must understand that the list it's super complexity, and normal people like us, it's just a weird and impossible names, very long with so many consonants that doesn't mean anything for us. Sometimes, for example, Ritalin, that we have many athletes here that use, especially athletes from Virtus. Ritalin, that it's a simple brand name, become methylphenidate with PHY. So we need to understand that these very hard names are going to continue impossible for normal people like us to understand. So this is why we need professionals like doctors, pharmacists to support us. Oh, I think that this is the most important, Henry. Like you said, to go to your doctor and double check. Sometimes your doctor is prescribing the medicine that is prohibited, but he or her can change for some that it's not prohibited. It's there, as you know, there are several treatments for one type of disease, one diagnosis. So talk with your doctor, personal doctor, and their team's doctor, and explain to them that you're an athlete, that you're going to pass through anti-doping tests. And so you should avoid any prohibited medications, but always talk with your doctor. Don't use the self-medication because it's very harmful. And we don't want to have any athlete sick. Roy, you have been an athlete for several years, and can you tell us if this kind of tip helps and how helped you during your career?
So one example of where it helped me, particularly taking the time to consult with a professional, sometimes in day-to-day life, we get recommendations from people. So I remember one time I was having quite a lot of sinus problems. I'd actually, blind football being the sport that it is, I'd actually broken my nose. And I started getting quite a bit of sinus pain. And a friend of mine said, recommended a particular decongestant. And I did, fortunately, being on a squad, elite squad, I had access to my squad doctor, and I asked him about it, and he checked, and he said, well, actually, this decongestant, certainly at the time, it wasn't prohibited generally, but it was prohibited during competition. So that was something I was like, oh, right, okay. So you've got to be careful even with some things that maybe in sort of normal day to day you can use, but you can't use it like around your competition as well. So it was really important. I was really glad that I checked about this particular decongestant, because it is easy, somebody says to you, oh, this is really good, and if you're in pain and you could potentially take something on a recommendation from somebody you trust, and it's not that they're trying to do any harm, it's just they don't understand the implications. They don't have to worry about banned substances because they're not training for an elite sport. So the whole making sure that you check everything is something that I've definitely took on board.
No, yeah, you're right, Harry. Can you explain to our audience the difference regarding medications prohibited in and out of competition? Because sometimes people they think that it's yes or no, but sometimes there are some medications that they can be allowed to use out of competition. Can you summarize the difference between in competition and out of competition medications?
Yeah, absolutely. So probably the easiest way I would explain is that in competition means from midnight of the day of the competition, or technically they say 11:59 the day before, and then throughout the time that the competition is happening, be it one day or be it something like the Olympics a bit longer, the Paralympics a bit longer, that's what the competition phase means. So basically, as soon as you start your event on the day, so you might not have competed yet, you might be competing later on in the day, that's when it starts at midnight. Now, out of competition means any time before that. So some medicines are prohibited, as Roy said, all the time, and some are just prohibited in competition because that's when it's shown to provide perhaps some unhelpful or not fair benefits to athletes. So just because a medicine is prohibited, it doesn't mean it's prohibited all of the time. And again, they vary a lot, but the important thing to know is that you need to check if you're given a medicine, because you might be able to use it, but just not in competition.
Can you give to us an example of a medication that is prohibited just in competition?
Okay, sure. Well, I think the one that Roy mentioned actually was the one I was going to explain. So a nasal decongestant is one that you can easily buy from a shop. You don't need a prescription. And if you're training, it's months away from your event, that's absolutely safe and fine to use. But as soon as you then get to the competition day, because that medicine can have an athlete advantage, it then becomes a banned substance. So actually, some medicines you might be relying on to take every single day, but you can't then take them when it comes to the competition. So the decongestant that Roy mentioned for sinus issues would be the one that I would suggest that is people are aware of.
So, for example, if I'm an athlete and I have sinus, and I'm going to take any sinus tab, a sinus congestion in a pharmacy, if I take, I must to stop some days before to the competition to not get tested positive on the competition. This is the right answer, right?
Yes, that's absolutely right, and do that the same for all of your medicines. And I think the key thing is to note that really what you want to do is to try and prevent taking any banned substances, But if you have to take them, then you have to take them. But obviously, you know the rules that when they're banned and they're not. So sometimes if there's another way to manage your sinus problems without taking that medicine, that would be the best way. But it's safe and fine to take the medicine. But as soon as it becomes to the competition day, you can't take it anymore.
Okay, just one more question before to take the floor. For example, I need to take a Ritalin that it's a prohibited substance just in competition. But my doctor tells me I cannot stop the treatment in the middle of the season because I need to have to go to the competition. What's the procedure that I should take? So I should stop to take my Ritalin before the competition? Should I stay? Should I call Juliana? What should I do?
Sure. So there are lots of medicines that people rely on every single day, and if they don't take them, that they will have negative health effects. So we have to balance it up. So in those instances, the athletes still need to take the medicine every day, even during competition. However, because it's banned, what we need to do is we need to apply for what's called an exemption. So we need to fill out some paperwork before you've had the competition, before you've had the event, to let the authorities know that you need to take this medicine every single day, even because it's banned. And then what will happen is that an organization will review that information. And if they are happy, then they are saying, yes, it is okay and safe for you to take the medicine that is banned during competition because you need it. But you must have that documentation in place beforehand.
Oh, thank you so much. The time is flying. So Renata and Tom that are here right now, do you have any questions to our athlete, Roy, or our pharmacist, Henry? Please open the microphone if you have. Yeah, Tom.
Yeah, thanks very much. Very, very informative. A bit about my background. I'm just recently returned to cycling competition as a masters athlete, and I used to be a technical official for cycling as well, so it's kind of gatekeeper turned poacher. But one thing I've come across is riders, us masters level cyclists, the level of knowledge about anti-doping is poor, very, very poor. And a lot of them have been taking legitimately products because as you get older, your bodily function changes, and some people might be on different types of medication. I'm also I've been training as a dope control officer, which kind of adds a bit of knowledge but can complicate things, and it's just more a question of how should masters athletes approach anti-doping, given that most of the effort, from what I can see, is at the elite level. If you're on national squads and things like that, the information doesn't seem to trickle down, and we end up. I've heard all sorts of stories of riders taking things just based on what they've found on the internet, which is worrying. So I guess it's, I don't know if I framed that question right. Is it just for masters athletes, how should they approach anti-doping? Given that some of them may be on legitimate medication and others may just be taking things because they think it will benefit them in competition.
I can give that an answer, definitely. So I think, yeah, absolutely. The first thing I would say is I agree that a lot of the information is provided to a certain level of athlete, and sometimes it doesn't trickle down, which is a shame. So we want to bridge that gap from all levels and all abilities. I think that the first thing is actually sourcing education, correct education. So like these webinars, or like the organizations online that have lots of different webinars from healthcare professionals or from the organizations themselves. That's the best thing to do, because even if they don't give you all the information, because you can't in a 1 hour slot, they will hopefully give you questions, and then you'll be able to know, oh, I know the resources available. So that's the first thing, to give yourself as much awareness about the topic as possible with education and resources. And then I would say to do your own research, and when you have a question, that's when you stop, and then you don't proceed any further until you've found that information. So sometimes looking online isn't necessarily the best way, which is then you would consult someone, or actually sort of go onto these, people like Juliana or similar. But the questions are there to hopefully help your education as well, if that makes sense.
Yeah, because I've seen some things that concerns me, and there's not any testing, or very little testing, because it's expensive. And if you're not in a pool, or you're not at the elite level, it's quite a grey area, and all you need's the somebody to turn up one day, and if you're asked to provide a sample, you could be in trouble. Yeah, that's been useful. Certainly, me and my I know where to look, but it's just trying to find a way that particularly the group of athletes I compete with and friendly with, that I make sure they're doing things the right way, and many of them are. But you do get some. As you get older, you're trying to keep up with the younger guys and girls, and there's different ways of doing that apart from training, unfortunately.
Yeah, and it's something that it's important that Tom shared with us. As much as you get older, your body doesn't work in the same way as you're used to. And this is one of the possibilities to include some group of people on the pool with high risk level of doping. So this is something important to everyone that is here. We have a high risk level of doping, not just sports, but also gender, countries, and age. And please remind guys, our body changed. So this is why we have different categories: junior, adults, and masters, to try to make this in a balanced and a fairness way. Guys, thanks for being here. Sorry, the time is running. My 25 minutes was super passing a flash. So I want to thank our speakers again, Roy and Henry, for being here. And if you have any questions for our guests, please send to us. We can share with them and get the answer. All the videos we are having here are going to be uploaded on our YouTube channel. So please, if you want to share this knowledge with your friends, share the link with our YouTube channel. Please follow our social medias, okay? And I hope to see you in the next episode. We are going to have 29th of July, okay? And see you there. Remember, the real champs play clean. Thanks, everyone. Thanks for our audience.
Thank you.
Thank you so much.
Thank you.
Thanks, guys.